right. Well, if you, I will just do a really warm welcome to everybody. Happy to have you all with us. We're very excited to be restarting our fireside chats. These were something that we used to do in the past, and had kind of let go of. And actually, Carol, is is one of the people who reminded us of them. One of the things we did decide to do is shift just a tiny bit so that we're talking a little bit about what we're doing, but also creating an opportunity for us all to learn together about new things that we're doing, and information that we're learning so that we're passing along information, and kind of keeping people informed and hoping that that catches on, that they'll tell their neighbors. So I will just, if you want to move forward. I'm going to give you guys a brief TCI update. I am so fortunate to be here with Alexa, who's our programs manager, and George, who actually was the person who did most of the building of this. And I so enjoyed working with George, and he is in Canada right now. But you will hear from him in just a few. Go ahead. So I'll talk a little bit about why we're kind of, what we're facing in 2026. So one of the things that we've talked a lot about is climate change is not just a science problem, it's a human one, and humans can find solutions. And so as we went through this past year, one of the first things that we decided to do in 2024 and 2025 was to start collecting the stories. We knew we had teachers out there doing projects, but we never really knew what they were doing. So we started collecting the stories of their projects. And I know Megan, will share a link to our action map. We don't have a ton of stories yet because we've just started collecting them, but all of them are amazing. And when we started looking at these stories, we realized that these stories were not necessarily what we expected. And so, as we are facing these times right now that are a little challenging, lots of changing laws and limited funding, we understand that these challenges also are opportunities. And so we started really thinking about how our programs are impacting and then also how we talk about our programs. And so we're sort of shifting those conversations. For those of you who haven't been with us for a long time, we have kind of exponentially grown, and now we are actually in a point where we can think really holistically about our programming. We went from one program to 750,000 people using our programming. We went from one to three teachers to 6,000 teachers. And so now that we've really kind of gotten the hold of what we're doing, we want to really hone in on how we talk about it and how we can use different language to really explain the impacts of what we're doing, because the impacts have been a little bit different than what we were expecting. So we've always worked to bring this global crisis down to the local level. And you can look at these pictures, and these are all local youth in their communities that are doing projects in their communities that are meaningful to their communities. And so when we set this out, we made these very ubiquitous modules that teachers could then hone in on what was happening in their communities and help their students communicate with people in their communities, connect to community members, connect to the landscape, connect to climate change as in context as it is in their community. And by doing that, they created action projects that were a little bit unexpected. So we expected all of these climate change projects, but what happened was is they were a little tangential to climate, meaning that they were building resiliency within their communities by finding out what the issues were. And some of these may be climate related and some of them not so much. But what we understand now is that we're building resiliency in communities, and that in and of itself is a protector against the other things that can happen. Go ahead and move forward. So, one of the big things that we've sort of shifted to, it actually came from a friend of ours, in Revision Energy, and he talks a lot about climate damage. We talk about climate change, and it's like this data point. It's this data point of carbon parts per million, or the melting ice caps, and it's really not. It's really difficult for people to understand. And we all have heard the argument that, well, climate has been changing forever and ever and ever. And so we look at this diagram right here where you see those red arrows. That's now. That's us in the past, 20 years. That's totally different than what you're seeing as the regular climate change. And he said, we should really start calling this climate damage. If we're understanding that we're damaging something, we also understand that there are solutions. And so, as a solution-oriented organization, we started really leaning into that. We're like, okay, so it's not necessarily the climate change that has always happened through the eons. This now is amounting to climate damage. And how do we then find solutions to that? So we've shifted our language beyond the science to a more holistic idea of planetary health. How do we look at the planet as a whole thing with us being a part of it and the damage that's being caused? And then how do we mitigate that and impact that? Because when we talk about 2 degrees of warming, that sounds really small. But then when you equate that to a child's asthma flare up because of wildfires or because of the extreme heat, then that becomes a crisis. Then it's real. And so bringing it down to the human level and the human experience, we have found has been really valuable. Go ahead. So why this matters? So why this matters is that when we talk about planetary health, we can sell solutions much more effectively because people are far more tuned in. We all know this. People can be a little bit more self-centered than many other creatures in this world, but we tend to think about what we can see, what we feel ourselves. And so when we're communicating about human health and why this is an issue because of some of the changing climate damage through extreme heat, through wildfires, through invasive species and disease vectors, it's impacting human experience. And then we can really relate to people because they're looking at their children, they're looking at their parents, they're looking at their loved ones and saying, oh, this is impacting us in a way. And so when we start talking about that impact, we can think through a different narrative of let's build greener cities, let's plant more trees, let's think about how we can get better food systems engaged so that we can feed ourselves healthier food. And it becomes more of a human issue that we have the ability to solve versus parts per million of carbon, which nobody really knows what to do with. So we're really trying to lean into the human experience in climate as well as connecting us to the systems that we are all a part of. We are not separate from the environment. We are part of it. We are part of this whole system. And so that brings us sort of to these 9 planetary boundaries. And I'm not going to go into them because we have another fireside chat coming up where we're going to really talk about the 9 planetary boundaries and what that means and where we are and how we can adapt to those. So I hope you guys will join us about that and learn some about that. Um, but I'm just really excited to launch this, and I don't want to take any more time. So I'm going to introduce you guys to the 2 brains behind that, which is Alexa and George. And I hope you are as inspired by them as I am and learn from them the way that I have.
Thank you, Leah, for the introduction. Hi, my name is Alexa. Like Leah said, I'm TCI's programs manager. And I just wanted to quickly sort of introduce the Learning Lab and to talk about some more of these programmatic focuses that we're sort of shifting to this year. Um, and so as TCI continues to grow and expand our offerings, we thought that it was really important to make that climate change and health connection. And having the opportunity to work with George with his research and his experience kind of made this all possible. So we're really excited for you all to hear from him about his experience making this lab. Um, but just to kind of make that climate and health connection, um, as most of you know, climate change is not just an environmental issue, but it's deeply intersected with that of human health. When our environments are unhealthy, aka when they're polluted or contaminated, when they're overdeveloped, that leads to us being unhealthy as well, both physically and mentally. So things like pollution and development, manufacturing, all of those things are contributing to climate change, of course, but they're also creating more and more health threats for us and for the environment. But health threats that might not be immediately recognized as being connected to climate change. Um, so as climate change drivers, things like rising temperatures, changing precipitation, severe weather, as those things continue to increase, so too do the risks to our health. So some threats that we're seeing from climate change, some health threats include increases in cardiovascular diseases, respiratory issues, insect transmitted and waterborne diseases, things like that. And so we're also, in addition to that, losing access to some of these ecosystem services that help protect our health as well. So ecosystem services include like access to fresh water that's being deteriorated or contaminated. Um, we're losing nutritious soil for growing food. We're losing access to climate regulation by forests and oceans and wetlands. And they're losing their ability to sequester carbon and regulate the temperature of the planet. So all of this is alarming for sure. But I say this because, as Leah mentioned, when we frame it as a health issue, this can kind of lead to some more common ground because we all care about our health. We care about the health of our families and our communities. And so when we can relate to it in this way, we're hopefully able to give people who aren't as familiar with climate change or its impacts an ability to kind of enter the conversation and to understand how it's impacting their day to day. Because again, like Leah said, it's easier to recognize that as air pollution increases from wildfires or from industry, it's easy to recognize, oh, I'm starting to have trouble breathing. It's not as easy to say, oh, I don't know how my community is impacted by the global carbon footprint. It's just harder. Um, and in addition, Leah mentioned the planetary boundaries, which is another programmatic and sort of language shift that we're hoping to take this year. And like she said, we will touch on it later, but I'll kind of briefly touch on it now. Um, and essentially, it's a framework that categorizes and highlights the risk of human action onto 9 different global processes that help to regulate the stability of the Earth. So it categorizes these processes and then within them categorizes both the causes and consequences of climate change. Um, and what's unique about this framework is that it can be compared to our own health systems. So our bodies all have different health systems that work to keep us healthy, and so does the earth. So when we think about it this way, we know that oftentimes health can be improved and that a challenge doesn't always have to be permanent. So when we can start transitioning away from climate change to planetary health, it gives us this more optimistic framework. And we're able to kind of think about these challenges in a more tangible way rather than relying on climate change, which to many people feels very intangible and like a problem that can't be solved. Um, so just to wrap up, both the planetary boundaries and this intersection between climate change and health is ultimately an important key for making all of this more tangible and relatable to people, especially our youth who are just starting to learn about this stuff for the first time. And we're hopeful that's another way to get people more engaged and taking action because, again, it's important for our planet, but it's important for our health and for protecting our planetary health as well. I'll now pass it to George, who can explain a little bit more about the lab.
Thank you so much, Alexa. Hello, everyone. My name is George Njoacha, and I'm currently in Edmonton, Alberta. Let me put it that way. So, I had the privilege to work with TCI as part of my practicum while doing my or completing my Doctor of Public Health at the University of Nebraska Medical Center. So, I think you all familiar with climate change, the impacts on everything. So there are a lot of things that drove me to this particular topic. And like Alexa, Leah, everyone is saying, there's been a lot of changes to our health, a lot of changes to the environment, which are all attributed to climate. So when I was thinking about the practicum, I thought about something that's like directly impacts me. And I just said, okay, I need to look at something related to climate change and health. And looking at the literature, you probably notice a whole bunch of information out there. So TCI had actually make things, streamline things to make it really easy for us to develop something. So to try to condense that material that is out there into something that is useful, something that is relevant, that is directly applicable to the users. So basically, teachers and students alike. So I guess a lot of us will probably be familiar with the TCI Learning Labs. So we utilize the same format because I believe it works very well. So the general format of the lab where we have the science about the issue. So in this case, climate change and health. And then we look at it from the three lens perspective. So social, ecological, and economic. Then we do some data analysis. Then we go to case studies. And then there's this the very interesting parts, which are they bring it home, the conversation, community conversations, and then they bring it out. So I believe we're all familiar with that. So we follow the same format, but in addition to that, we added a few things. So since climate change is impacting the world at large, so nobody, no community or no country is being spared. So we took a global perspective in terms of incorporating case studies from across the world. So this particular lab, we have a whole lot of different case studies which are applicable to different hazards, so to different climate drivers. And then in addition to that, we're lucky to have a few teachers or instructors go through the content and provided feedback, which we use to at least finalize that. So their perspective was very useful to us. So we're trying to develop something that they can actually use and is applicable. And I must say that it was really tough for me because um, just trying to bring down the content to the level of like elementary, high school wasn't easy. So, but thanks to Alexa, Leigh, and all the team to try to get me refocus all the time because sometimes, in my experience, I've done like graduate teaching things. So, just trying to bring down the content down was a lot tougher than someone would expect. So thanks again for that learning opportunity. And then in addition to that, we're able to incorporate real data from organizations. So from World Health Organization, National Oceanic Administrative, and EPA. A lot of the data that was out there, some of them might not be there, but we try to look at data from other organizations that are probably non-governmental. And then we also added a couple of games, plays, exercises so that it could engage younger folks because I believe the future of our actions probably rest upon the younger students. So the hope is that we train them to see the benefit of all these climate actions that have been taken and try to live those. So the ultimate goal of the whole lab again was to empower users to take action. So one, make sure that as you're studying or as you're going through the lab, you're starting to think about what is happening in your own environment, what is happening, maybe starting from yourself, have you, how's your head been affected over the last maybe 4 or 5 years? And for myself, I'm originally from Cameroon. I came to Canada almost 17 years ago. Um, I never had anything like allergy or seasonal allergy or anything. So over like I was here for about 7 years or so. Then summertime came and I started having all these itchy eyes, watery eyes, and things like that. And I went to see the doctor and they say, "Oh, it's seasonal allergy." I'm like, "What is seasonal allergy?" Say, "Oh, the pollens, everything that is out there is causing this." But they're like, "Oh, I've been here for this number of years. Why is it happening now?" So fast forward today, even in the winter, I still get affected by seasonal allergies. So I still have to take some of this over-the-counter medication just to deal with those things. So it just tells me like how the climate has changed, or the environment has changed, and so many things happening that are impacting our health. So looking at all of this, I believe the goals for the users again to be able to take adapt their ways of life or strategies, community actions to better protect the future, protect our current generation and the future generations. We probably don't want our children coming up to an environment where everybody is um, affected by allergies or something, right? So we want to be able to take actions. So on the right there is a picture which kind of summarizes the perspective that I took in developing the climate lab. And Leah had already alluded to a couple of days when she spoke about on her slides on why this matters right now, where she had that circular image. So this is another way to represent a circular image. And yeah, we're just looking at how the different things that actually take place to for us to experience something, an outcome. So we've seen the different drivers of climate change, so increased temperature, precipitation, extreme weather events, and so on. So basically, for us to we take a perspective of what we consider in toxicology and environmental sciences, like risk assessment. So there's always that exposure. So you must be exposed to something, and then your body reacts to it. So maybe you have vulnerability to that particular threat or hazard, and then you get an outcome. But with climate change, it's not just like straightforward. There are a lot of other factors that come together to cause that outcome that we see. So there's different environmental, social, behavioral contexts or factors. They interplay to affect our ability to respond to the drivers of climate change. So this picture or this image was taken from a scientific assessment that was done on climate health impact in the US. And basically, like I said, climate drivers, we are very familiar with climate drivers. So exposure pathways are the different things that we see. So extreme heat, for example, when the temperature is high, we get all this extreme heat, the heat domes that results to a lot of different things. Um, Poor air quality, so again, dry temperature, increased temperature, flooding, all of those things can contribute to um, the quality of the air. With Alexa mentioned reduced food and water quality due to flooding, contamination, all of that. So changes in infectious disease environment. So when we have all these wet environments, even areas where they never used to have like mosquitoes or Lyme disease and all of that, you start growing all these different vectors that um, transmit these different pathogens. So all of this impacting health, not just in the developed world, the developing countries are experiencing um, this disproportionately. So the impacts in developing countries is high. We see a lot of ecosystem changes, drought, and there are a lot of countries that have not been able to grow food for many years. So that's affecting their agricultural production. And if this happens in developing countries, they might not have the fundings to irrigate their lands. Maybe there's not even water for normal use or for regular use. So they can't even use it to irrigate the lands or to um, um, treat or to provide the animals or stuff like that. And then again, we look at the social and behavioral context where um, basically we're concentrating on the social determinants of health here. So older folks, for example, will be more impacted. So when there's a heat dome or heat waves, the hospitals are always so much overwhelmed with maybe calls or older folks having a lot of different issues, and those are compounded again by sometimes medications that they're on and a lot of other characteristics, poverty, education, access to care. So access to care is a big one, and I will show you some numbers that are a little bit old, but I got them from World Health Organization. So it kind of shows the global context. So they're a little bit from like 2022. So um then like I said, pre-existing conditions. So pulmonary heart diseases or just chronic infection. So basically, this slide, like I said, kind of summarizes the perspective that I took in developing the content. Um, what else should I say? Yeah. There's also another concept here that I would like to just quickly mention. So we talk about vulnerability. So an individual's vulnerability relates to exposure. So exposure to the different hazards. And then it's also related to sensitivity. So a degree to which a person is affected by the hazard. So the hazard in this situation will be the drivers of climate. And then we also have what we call the adaptive capacity. So how an individual or the community or institution can adjust to the hazards, right? So this comes to the adaptive or mitigation measures that we can implement at the individual, at the community, maybe national or global levels, right? So I'll probably, Megan, I don't know if you're the one controlling, please move to the next slide there. Thank you. So this again, basically a summary of the previous slide, just listing a number of the outcomes, health outcomes that we're seeing, and this is an image from the World Health Organization. So again, talks about the vulnerable factors, and then the health risk, and then the exposure. But I want to dwell on the outcomes here. And these are some of the things that we're seeing, and they're increasing. So we know climate change is increasing the frequency and severity of disasters across. So it could be disasters. Technically, we typically look at them as human-induced or man-made. Um, there's a whole lot of movement out there that is trying to push away from the terminology of natural disasters, in the sense that they believe that nothing is natural, like people's action are actually driving all these different things that are happening. But again, like I said, it's a whole lot of debates. Some people argue that no, there are certain things that can be natural, but predominantly, um, this group of scholars arguing that a lot of the disasters are human induced, so our actions are actually driving these things. And we see the health outcomes from all these different things to be increased mental health issues. So basically, increase in zoonotic diseases, low, so food insecurity, so low food yield from drought and floodings. What else do we have there? New diseases, so people that never used to have issues, they just maybe from nowhere or something has been building. Definitely, it happens over number of years, but you probably just feel like, oh, you're okay, but from nowhere, you just start feeling sick, and before you know it, you have an issue and it becomes recurring, right? So all these things basically impacts the healthcare system and the facilities that we've built, the governments and other private institutions have built to cater for the health of individuals. So if you could think about the impact of this on the poor. So a lot of people that are not able to access healthcare. So a lot of countries that have very fragmented health system, and a child suffering from malaria, for example, is not able to see a doctor. And the incidence of malaria is increasing in a lot of developing countries. And just as an example, we've all seen images of floodings, wildfires, and so on, and how they impact the general population. So if you can think about, again, those who are more vulnerable, the poor, children, the elderly. So you get a picture of how they are being impacted, how they're suffering. And the question again comes back to what can you do as an individual, as a community, as a nation to help this situation? Um, you can move to the next slide, please. Let me see. All right, so this slide here is just I just wanted to put this in perspective of numbers, and this is um, the stat that I was talking about from WHO from about 2022. So it's just highlighting the impacts of the climate change on health, on multiple components or systems related to health. So we see food, nutrition, um, billions of people can access safe drinking water. Um, over 600 million foodborne illnesses annually, so that's significantly increased, and that's affecting more than 30% of, that's resulting to more than 30% of deaths in children under 5. We see the number of hunger that is increasing every year. When you look at health, heat and mental health, again, the percentage of the mortality and morbidity related to that is increasing, and we see that a lot in older adults. So disease burden, so foodborne diseases, insect-borne, um, or vector-borne, and so on. So the WHO is projecting about over 250,000 climate-related deaths annually by the year 2030. So that's a stark number, and it's so frightening, so concerning to most of us on this fire chat, and I believe we need to take action. Um, no matter what you can do, doing something is better than nothing. Like we always say, prevention is better than cure or something. We have to prepare for these things. We have to have those conversations within our homes, within our communities, our schools, our communities, networks, and all that, so that every action that any one of us takes can help in this overall system, the global sense of things. So the health system is there, is broken down, and you know the poor continue to suffer. Like I mentioned already, they can access um, high quality care because of the increased costs and the complexity of everything. So it's not just that they can't eat, but they're not able to access health care services. So when you put all this together, you see the compounding effect of the climate um, damage. I like a terminology layer, climate damage. So what else can I say? Yeah. So next slide, please. So putting this all together, I think one of the big benefit of the climate change lab is helping us develop our knowledge. So when we go through this, we'll be able to understand these drivers, to understand how climate change is impacting our health, and we can learn from what is happening in our communities. So locally, and take actions at that level. So we have to start from somewhere before um, a lot of the actions that we take at the community level get expanded or multiplied at, say, the state level, and then from there to the federal level, all of that. And then, in addition to that, the lab is hopefully going to help us to hone some skills in being able to assess climate or recognize climate damages, put it that way, being able to recognize the impacts of climate and thinking about how we can adapt to this and what other mitigation strategies we can take to continue to protect the planet. And like I mentioned a lot about disproportionate impact to the poor, to the older persons, to children. So this climate lab again is going to help us to try to bring that equity lens into place. And I believe most of us here, we have different backgrounds. So again, just to enhance that interdisciplinary collaboration. So I am positive that if our actions, we can really transform the current environment. So like the picture that you see there, um, we can transform all this drought, all this dryness into the green vegetation and continue to live for the future generation. So that's all I have regarding that. So thank you again. And yeah.
Thank you, George. And I'm just curious if there's any questions about any information, or if you're curious about any information, I'm sure while we have George, he can answer some of those questions. Some of us might be able to also, but he's the expert here.
Oh, Leah, when you say I'm the expert, I'm just like, I'm still learning everything from everybody every day.
Are there any
There's a lot.
questions?
Sure. Why not? I'll ask you a question. Um, so now that this learning lab has been developed, now what? Where does
Now what?
Now what? So I'm actually going to jump in here really quickly. So Carol, we just launched advertising. So part of our secret sauce is going direct to educator with these amazing resources. So we've already launched an advertising campaign to reach teachers where they are digitally, on top of our 5,700 incredible TCI educators that are, daily with us in our educator hub that's housed on our website. And we also have, so our key event every year, our climate educators retreat, we have, hundreds of super users, if you will. And so they also have access to the lab now. So really it's about kind of scaling use of the lab. With us finally going live this month. So I just wanted to share that kind of from a launch perspective. We're really working hard to get it out there into the hands of as many teachers as we can, because each teacher reaches 30 youth. And if they love this lab like they have with so many of the other ones, then it's exponential, it's annual use, which is really exciting. So
Yeah, and the other piece too is as we are expanding sort of our reach, looking to work with schools that have nurses, schools that are training nurses, schools that have educators that are in health, in physical health. So we're sort of looking at how do we create the idea that climate change is not just a science problem, but it's an interdisciplinary human problem. And so the more that we can engage people in the different topic areas, we've been really lucky to be a part of a neurology group, and we're looking at climate impacts on the brain, and that will probably be another sort of place that we will go after this. So I really think being able to partner with health industry and understanding how doctors and nurses and things like that are being trained to understand what is climate impact and what isn't, and being able to figure out how they're bringing climate into the trainings that they're doing. The same way that we're trying to work with pre-service educators, we're really trying to figure out how do we work with people before they enter these professions so that they really understand impacts of how climate change impacts their career choice. And
awesome team.
Pam,
Yes, sorry. We have the first question is this for non-traditional teachers. So would love to hear Alexa and Leah talk about some of the educators that we see come through our doors.
Go for it, Alexa.
Obviously, yes, the short answer is yes. We have educators from across grade levels and disciplines all using our learning labs. And they're designed in such a way too that like when you're not a science teacher, you can still take bits and pieces of the lab and adapt them to your classroom and your lessons. So, for example, lesson two in every learning lab is about case studies. So, if you're an English teacher, you can assign this case studies activity where students are learning the English skills of researching and building a case study, but they're just doing it with the climate focus. And vice versa for lesson three, for example, it's all about data. You can use that in a math class or a science class. Um, so yeah, we really encourage educators to take bits and pieces, use the whole lab, or take the bits and pieces that work the best for you. Because again, this is an intersectional issue, and it's important to start kind of weaving it into conversations that are outside of science or those other typical climate spaces.
Yeah, exactly. And I think also when we talk about informal education, we can even think through land trusts and people who are working in 4-H or anything like that. And these are obviously very open for them as well. I know there's some other questions in there.
I
Yes.
can jump in and
Oh, go ahead.
I was just going to say I can jump in and answer. Pam had a question about action projects that we have that are kind of related to this, and one of them that's really cool is there was a health class that was also looking at climate, and in Seattle, well, Spokane, I think actually, and they focused on sort of the heat part, heat islands, and whether or not how much that affected the residents and what they could do about that. And so they did a whole like research part of it, and then they did some practical on the ground work to try to help residents that were really struggling with heat. So that's kind of a way to approach some of this. So it's not scary. It's not as scary to come at it from what can we do and what's affecting this local community. So that's a cool project just off the top of my head, but I can get some more examples for you if you want.
And that kind of leads to the question, I just typed it in there, but that Michael asked is how do we teach this without scaring students? And that's one of the things that TCI set out to do from the very beginning, is to really work on solutions and getting students active in their communities with action projects. And that's been proven through a lot of studies that having students work on action projects to mitigate or to educate other people in their community about these topics actually alleviates climate anxiety and helps them feel like they are they're agents of change. And really we're really starting to try and follow that thread of civic engagement and lower anxiety levels and those kinds of things. Those are harder to measure, but that's where we're kind of aiming in the future is how do we measure those intangible things that kids are getting from these lessons that we know the studies have proven. And in fact, my PhD is going to be kind of on that. So, so hopefully we'll get some more information that way too.
Awesome questions.
Yeah, great questions.
Thank you. I do want to say we are at time right now. We had one last slide to talk about our climate educator retreat that's coming up. We had a 3-minute video about last year or a 30-second video, and I'm not sure where folks are in your evening, but we're happy to send all this information in our follow-up as well. We don't want to keep anybody past time.
Yeah, thank you guys for joining. And if you have any questions in the future, please feel free to email us or get in touch and we will get you the answers that you need. And hopefully we will see you at the next one.
Yes, thank you so much. And we'll be following up with a recording and all that info that we promised. So thank you.
Thank you.
Awesome. Thanks, George. Thanks, Alexa.
Thank
Thanks.
Thanks,
you.
everybody. Good night, all.
Good
Bye.
night.
Bye. Yay. Thanks, everybody.
Nice job, you guys.
You too.
So happy to work with you.